You know, it's funny, when I came in here earlier this evening before we started and just saw the stage and the auditorium, I just well remember the night that I was sitting in a chair in an auditorium after I had graduated. So it's a great night, so congratulations. Well, good evening. It's wonderful to be with you here tonight. In this new year of 2014, you graduated with an associate degree in nursing. In this new year of 2014, I'm entering into my 4th decade of nursing. Each decade has revealed certain truths, choices, and wisdom learned. One of the best choices I made, and one we all share, was the choice to become a nurse and a graduate of J. Sargent Reynolds. So, congratulations. My decision to enter nursing school and become a nurse was triggered while I was working as a psychiatric assistant at the Pavilion. A patient had coded, and I witnessed several nurses grab a code cart and revive this patient. These nurses and one doctor brought this patient back from death. It was 1977. I was 23 years old. I had just gotten married, and I knew that I wanted to become a nurse. I began taking the math and science classes that were necessary to prepare myself for nursing school admission, and as Elaine shared, in 1980 I graduated from J. Sargent Reynolds with my associate degree. What you have accomplished is great and noble. As you look to your future, you know tonight is not an end but a beginning. Any nurse entering into their first clinical setting to practice nursing is a beginner and a novice. As Pat Benner in her classic book, From Novice to Expert, states, since novices have no experience of the situation they face, they must be given rules to guide their performance. Nursing school has taught you those rules. Rules like checking a patient's weight. Rules like your eyes and nose, checking your eyes and nose for fluid balance or imbalance. What you will discover as your clinical nursing practice evolves, and true to Ms. Benner's point in her book, is that competencies build and go beyond the science and the rules. In fact, she theorizes that once you are practicing at the expert level, those rules can be extremely limited and inflexible. My first year practicing was in an HCA hospital, medical, 44-bed medical unit in Plantation, Florida. The staffing ratio was 44 beds. There was one charge nurse for all 44, and then each side was separated into 22 with a nurse, an LPN, and 1 or 2 nursing aides. In that first year, I mostly learned time management, work, and patient prioritization, the importance of teamwork and communication, all essential competencies. My nursing practice witnessed many clinical presentations: congestive heart failure, Guillain-Barré syndrome, pneumonia, and the hazards of immobility for that unit held mostly a geriatric patient population. It was hard and it was stressful. I learned from each experience. I was out of the protective shell of nursing school, where instructors were close by to guide and mentor. I had to make decisions based on what I had learned from book knowledge in my clinical settings. I had to follow the rules because I had no real experience to know how to piece it all together to care for the patient. The accountability and reality was intense for me, but I've also learned that I can be intense. So, so I just assumed that accountability and reality. And I cried more than a few nights from the stress and the desire to be more experienced, to know how to care for and how to intervene on the part of my patients. In year 2, I was courted by the head nurse, and they called them head nurses in those days, into an 8-bed ICU, where I was the rookie RN working with several experienced ICU nurses. I recall a patient for whom I was caring, and the morning when I went into his room following report, and I observed him turning a paler shade of blue. Well, I immediately went to take his blood pressure when the experienced ICU nurse ran in and managed the airway and started bagging the patient. She knew the ABCs of life support, a basic rule to never forget: airway breathing compression for those non-nurses in the audience. You can bet I learned from her intervention, and I remember that nurse to this day. She helped me, the beginner, to gain confidence. So be patient. Your competence, like mine, doesn't become fully realized until you've been practicing nursing 2 to 3 years. By then, you can see some of the results of the actions and interventions. You gain a perspective, you gain proficiencies, and you start feeling an ability to cope with and manage the many contingencies of clinical nursing. As Pat Benner shares, and I paraphrase, the mastery of the activity comes from the transformation of the skill. The expert performer no longer relies on a rule, guideline, maxim to connect an understanding of the situation to an appropriate action, but now has an intuitive grasp of each situation. Intuitive grasp allows expert human decision-making possible, but it is not possible without a sufficient background and experience with many similar and dissimilar situations. My clinical practice grew in my 12 years of bedside nursing in a surgical intensive care unit, mostly caring for cardiac surgery post-op patients. I went on to obtain my critical care RN certificate to learn more of the science and pathophysiology behind critical care nursing. It was here that my practice evolved from advanced beginner to expert. One of the best books I came across was Common Sense Approach to Coronary Care by Vincent and Spence. I still have that book. It was in the fifth edition at the time of my need. I really was going to Google it and see what edition it was now, because I'm sure it's still out there, but it was awesome. It was a book that directed both to a beginner and an advanced practitioner level. And it's a good example of the premise that teaching is an art rather than teaching, as well as an art rather than a science. As nurses, I would encourage you to be inquisitive and persistent in your thinking of various approaches to patient care and treatment. Again, be patient, be alert, be kind, and allow your expertise to develop. Listen to your patients and their families. Talk to them at eye level. Hold their hand. Advocate for the patient who has learned that they just have been diagnosed with cancer or heart disease or a terminal illness, or at 21 years of age, while a junior in college, have had their first psychotic break. You will be managing patient outcomes. You will be managing patients' pain. You will realize that death is not always something to tackle, but to accept it as a natural part of life and your treatment. Should your choice be to practice in a hospital setting, know that service excellence standards are significant in patient care as our core measures in patient outcomes. Weave empathy into the daily fabric of the patient experience under your care. Entrench your experience and clinical learning to gain expertise in communication, teamwork, respect, quality, accountability, and most important, compassion. Your journey will be rich with patient-centered, compassionate care, stories, and experiences. Your journey will be rich with new friendships, physician and nurse mentoring, and hopefully even with the administration at the facility if you work in a hospital. Show grace in difficult times. Lead by example. Give your patients your time even when you don't have it. Be passionate about your choice to enter nursing practice and healthcare. There is really no other industry as interesting as healthcare. It's a marriage of science, research, technology, service excellence. The art of clinical practice all culminates in improving the lives of our patients in the communities that we serve. And they rely on our care, expertise, and compassion. In this season of Advent, where songs of Hark the Herald, I have to throw a song in there, I'm an elder, but I won't be singing. In this season of Advent, where songs of Hark the Herald angels sing and angels we have heard on high, serve to remind us on earth that the song of the angels is a song of triumph. The song of the angels is a song of hope. Nurses are often compared and called angels. May the gifts you have within and the teachings of J. Sergeant Reynolds resonate in each one of you. Take your triumph in finishing nursing school and go out into this world to serve. I thank you for letting me be a part of this lovely evening and your life story, and happy New Year to you all.
Give to my eyes the ability to see those in need. Give to my heart compassion and understanding. Give to my mind knowledge and wisdom. Give to my hands skill and tenderness. Give to my ears the ability to listen. Give to my lips words of comfort. Give to my spirit the